Guys, how's it going today? This is Jim from the Pain PT. Today I want to go over an article I posted on one of my blogs regarding anger. And if you're interested in signing up for my blog post, you can go to thepainpt.com and connect yourself to become a blog subscriber. I try to post something about once a week just with information or research or articles regarding chronic pain, chronic illness related to mind-body dysfunction. So we're going to go over today this article that came out this year, 2022. It was a review article, and the title was called At the Intersection of Anger, Chronic Pain, and the Brain, a mini review. So I just want to show you guys the power of one emotion of anger here and how it plays into pain, how it can cause pain, how it can make pain worse. We'll go over a couple of the studies that they review here. So when we're talking about pain, one of the first things we want to do is decipher what type of pain we're talking about. Now we're talking more about chronic pain in this case. This is what they call nociplastic pain. Okay, now these are the conditions they describe here as no evidence of peripheral tissue or nervous system lesions or disease or poor correlation with structural findings. Okay, now examples of this can be fibromyalgia, any type of primary musculoskeletal pain condition like chronic back, neck, leg, pelvic pain, complex regional pain syndrome called CRPS, TMJ problems, irritable bowel, tension headaches. Now, as we know, there's many more conditions that we can lump into this pile of nociplastic pain. Now, one thing I talk a lot about is this brain activation centers or dysfunction in the brain centers, because this is where a lot of this stuff originates from. The emotions, they originate from the brain. And what they found is that with nociplastic pain conditions, they're associated with altered neural activation patterns in affective brain regions only. Now the word affective with an A, not an E, means emotional. Okay, so let me say this again. Nociplastic pain conditions such as non-specific chronic low back pain are associated with altered neural activation patterns in emotional brain regions only. Okay, particularly what's called the ACC, the medial prefrontal cortex, which we talk about a lot, and the amygdala. So this is why we want to focus on the emotions, guys, when we're talking about chronic pain, because those parts of the brain have changed or are working in a different way. We need to access them and get to them for a recovery. So that's why we're working at the brain level, the limbic brain level. So one of the things to talk about here is that different types of strategies, which we're going to go over, and stuff that I teach in my coaching, which is emotion regulation strategies, or what they call emotional awareness and affect labeling. Paying attention to emotions and naming them may reduce chronic pain, where suppression or inhibition of emotions may exacerbate chronic pain. Now they're citing 1, 2, 3, 4, 5 different studies there. And I've talked about that with becoming more aware of your emotions and affect labeling, that paying attention to your emotions and acknowledging them, naming them, has been shown to reduce chronic pain, whereas suppression or inhibition of emotions or avoiding emotions can exacerbate chronic pain. I'm not going to go through all this stuff because there's a lot of details here, but I want to pull out a couple specific things here. So we found in particular with the emotion of anger, okay, that state anger, okay, which is this ability to be angry in certain situations, but when we inhibit that or we overly express that, both those extremes, okay, whether suppression of anger or overt expression, means we're yelling, shouting, hitting, screaming out loud, both those extremes have been associated with greater pain severity among nociplastic pain patients. Okay, state anger inhibition is highly associated with greater pain among nociplastic pain patients in numerous studies. So inhibiting your anger expression. I'm going to read from this article. In all experiments, state anger inhibition led to both greater anger, greater pain intensity. Patients who are told to inhibit anger also show greater behaviors associated with the pain, such as wincing and greater low back muscle tension as measured by EMG. So this is interesting because in one of these studies, they found more muscle tension. Now, when I say the word tension, that's one of the words I use to describe anger in the body. When you feel tense, a lot of times they're tense, tight muscles. A lot of times that can be anger. Okay, so if we take your symptom and convert it to an emotion, that can be anger. And that's what this study showed, is that these EMG, which measures the muscle contractions, was showing greater tension when people had anger, but they weren't expressing it. They were holding it in. Okay, so they also say that there's a difference here. So one important study indicated that these low back pain patients had a different, more tense physical experience of anger. Okay, so this is what we call tension myositis syndrome, or TMS, that Dr. Sarno coined. So they had a different, more tense physical experience of anger than healthy, pain-free controls. So healthy, pain-free controls may experience anger as more classic anger in the body, which is heat rising up. So the way to describe classic anger is that in healthy adults, classic anger includes prototypical physical sensations, namely a sensation of rising heat or energy moving upward from the pelvis, abdomen, up the chest, arms, and jaw, and then down the legs. Okay, so that's the physiological expression of anger in the body. But with these chronic low back pain patients, they had a different, more tense physical experience. Okay, and it was located more in their back. Okay, so it was located with the degree of tension with anger was positively correlated with the pain severity. Patients, not controls, experienced greater low back muscle tension during anger induction compared to neutral or sadness conditions, as recorded on electromyographic, or EMG. Furthermore, the amount of muscle tension in response to anger positively correlated with everyday pain severity in patients. So there you go. You're getting your link there, guys, between how anger can be expressed very physically in the body, yet people are seeing that as back pain and stopping there. They're not taking it to the next level and say, well, actually, this is just anger potentially in my body. It's not pain. It's not just tension. It came from the brain. And like I said, it's because the emotional brain is involved. It is an emotion that's being produced, but being felt very physically. Now, of course, somebody could have back pain that's produced locally, meaning they have a structural issue there too. But we're trying to rule this stuff out. And as you guys know, with chronic pain, it's typically more emotional than structural. Structural pain typically heals in an appropriate amount of time. One other interesting study here was that they found another longitudinal study, so it's a long-term study of married couples, showed that suppressing or inhibiting anger during episodes of marital conflict predicted increases in musculoskeletal pain over 20 years of follow-up. So they followed the study for over 20 years, and they found that people who were married and they had some conflict in their relationship, the person who suppressed or inhibited their anger, they showed increases in pain over the next 20 years. So there's a correlation there. Both state anger inhibition and episodes of unhealthy anger expression, like I said, lashing out, screaming, shouting, both those things can precipitate worse pain in nociplastic pain patients. In another study, they found they had people keep a diary in 3-hour blocks 5 times a day for 14 days. And they found that when people reported state anger inhibition or suppression, they reported concurrent increases in pain, interference, and disability. So right around the same time. People who had unhealthy anger expression, so this is the other group way over here that's just blowing up, you could say. Such as shouting, they said here. Worse pain intensity and pain interference occurred at the next assessment, 3 hours later, suggesting patients had a subsequent painful reaction to their aggressive behavior. So what they're saying here is that for some people who are overtly expressive of their anger issues, they're blowing up all the time, their pain may come at a point later, not at the time, but 3 hours later in this study, where some people who hold their anger in, they had increases in pain and disability at the time. Okay, they were doing that. So last thing I'm going to share with you guys is what, part of what we want to do, the solution to this, and what I try to work with people on in my sessions is that we're trying to show, like other studies here demonstrate, that improved anger regulation and healthier, less tense experiences of anger can improve pain, assuming a powerful, dominant posture rather than an inhibited, tense one, and private verbal expressions of anger, such as swearing to oneself, have shown to improve pain thresholds in non-clinical populations without destructive interpersonal effects. So what they're saying here is that when you can privately express your anger, which we try to do in some sessions or teach people how to do, which some people do through journaling, but you can do in your mind, such as swearing and saying how you really feel to yourself, acknowledging that anger, it's shown to improve people's pain threshold, meaning they don't have as much pain. They're less likely to get pain. The other thing they found was that an anger awareness and expression training program, so what we call anger awareness and expression training, Dr. Schubiner and Dr. Mark Lemley started this program. It's a way how we get in touch with anger and how we learn to express it. In this particular study, it improved the severity and frequency of tension headaches by guiding headache patients through experiential exercises like privately verbalizing anger, practicing angry facial expressions and postures, and engaging in assertive, effective, and well-regulated communication of anger to others. So not only do we want to express privately our true feelings of anger, to acknowledge them, we're really trying to get to a point where we can engage in, I say, more empowered, more assertive, more constructive anger expression, where we can express how we feel, not hold that in so much, because that, again, creates more pain, as you're seeing here. So this, these studies here, this emotional awareness and expression therapy, EAET, as it's called, they've done studies on this, and what they found is that it showed improvements in pain levels, okay, even better than cognitive behavioral therapy. So patients who went through these sessions, what they found was that they had greater pain reduction than people who just went through cognitive behavioral therapy. So it's considered a treatment of choice for nociplastic pain. People who practice this, and I see this too, is that you can see large improvements from this emotional awareness and expression therapy. It's achieved because the emotion regulation techniques normalize activity in the neural networks involved in both emotion and nociplastic pain. So again, we're working at the brain level. It's been shown with fibromyalgia and chronic musculoskeletal pain. EAET, emotional awareness and expression therapy, has demonstrated large effect size reduction in pain severity, pain interference, and other symptoms like anxiety that are greater than control interventions and cognitive behavioral therapy. So, saying all this, guys, this is what I want you to understand today and take away from this, is that this one emotion of anger, which is one of your core emotions, primary emotions, we need to address it. It's very, very common. Dr. Sarna was correct. It's very, very common in creating pain in the body because it creates tension in muscles. It creates this constricted, clenched feeling that when it's not expressed, it sits in the body as this tightness and tension, which creates pain. So we're learning to try to express this anger in a healthy way, not hold on to it, not inhibit it, not suppress it. Okay, so that's the takeaway here, guys. So reach out if you got questions or you want to learn how to do this more. It's an important piece of dealing with one of the emotions of anger. And put your comments here, and hope you guys are having a good day and making some progress. Talk to you next time. Bye-bye.